everybody. I am back to do another video. I'm Cancer Val, who loves you. This one is going to be slightly different. I'm going to be showing you parts of my anatomy, which I don't want to do, but I have to do it for this particular video. So during this cancer process and going through chemotherapy, I've experienced blood panels that have come back and said that my blood ranges, white blood cells, red blood cells, platelets, were out of range or low or in critical condition. So every time you do the chemo, they take your blood first to make sure that it's safe. So I've had at least 3 or 4 instances, because the chemo is killing everything. It's killing all the bacteria. It's killing your physical processes to make healthy blood, because it's all chemicals. So during that process, one of the treatments to this, I don't want to call it a treatment, I don't know what else to call it, but one of the therapies, let me call it that, are these injections. And I'll just show you what it looks like here. I've opened it up. It's an injection, right? And I had to learn to self-inject myself. So I was taught how to do this by the nurses at the infusion center. Now this product is called Nivestym, all right? And I do one of these injections once a day, every day for 7 days after the chemo. Now I've done this also a couple of times before the chemo, because my white blood cells were too low, and this particular product boosts the white blood cells, which become severely depleted after the chemo. So basically, this video is going to show you how to inject yourself with this particular brand. Now, there are other brands of this product. I believe they're made by Amgen, the pharmaceutical company. One is a patch that you can wear for 7 days, and it gives you the dosage. And there are side effects, right? So it's based on the person, what the side effects are. For me, I just felt really seriously weak when I start taking this, and I get what I call bone aches in my legs. So my feet and my lower legs ache, and I can't explain it any other way. You have to go through it, but that's one of the side effects of this particular drug. So without further ado, I'm going to move the camera and I'm going to show you how I inject myself. Now, I inject myself, so I'm warning everybody, in my belly, all right? So I'm going to be showing you my belly skin. Again, it's not something that I want to do, but it's very quick, and it's so I have a sort of a flabby belly. You'll see it in a minute. And it's the flabby part, and they call it something. There's like 2 places where you can put injections, and the flabby part is the least invasive part to put an injection, like any kind of injection, all right? So so for me, I inject this into my belly, and what you would need is you'd need a glove, all right? And you need a alcohol prep wipe, because you want the area to be clean that you inject in. And then I have a cotton pad that I press on the injected area once it's done, all right? So I'm going to show you how this is injected right now, all right? Now, with everything, of course, you want instructions. So whatever infusion center you're at, or whoever's going to give you this prescription, needs to teach you how to do this, all right? I'm just going to give you how I do this, all right? That's not to say this is how everybody does this, all right? So for the most part, you take the injection out, and then you remove the little cap, all right? And it may drip a little bit. And then on the injection itself, where's the camera? There's a little guide, all right? So you can see the guide. Let me see if I can get my finger on it. Come up here to the camera. There's a little guide. Oop, sorry. Right there. There's the guide, all right? And you're going to pull this injection part out so it doesn't fall out. You don't want the liquid to fall out. You just want it so the plunger part, you have room to move the needle. And here's the needle right here, all right? So you can see a drop of that stuff on there. So now I'm going to move the camera, and we're going to move it down to my belly area. Boop. All right. And here's my lovely belly area. So I do have a belly. So sorry, don't have those abs that everybody else has. So I have this little thing here. And I'm going to take my glove and put it on. Your hands should be clean, all right? And you can put on 2 gloves if you have 2 gloves. To be honest, I don't always wear a glove. I just wash my hands first. But for the sake of this demonstration, I got the glove on. All right? And then what you want to do is you want to pull the fatty area of your abdomen, all right? And you want to pull it so you've got like a little chunk of it like this, all right? And so it's pulling up. And then what you want to do is you want to alcohol prep it, all right? So we're going to do the alcohol prep part where you're going to put the injection. And then I'm going to move my cylinder of my injection so it's ready, all right? And then this is how I was taught to do it. You want to put your hands on the little steps. There are like 2 little step things here for the injection, and you're going to pull, basically push this lever in, all right? So I'm going to put it at an angle. I don't know if you can see this. Let's see if I get it to the camera. And then in the fatty area that I've pulled, I'm going to insert my needle, all right? And this particular needle, if you do it right, it doesn't hurt, all right? There's a little piercing that happens, and then you're just going to press in the liquid, all right? Until the injection, the needle part injects out of the belly area. And it'll do it on its own because it's all automatic, all right? It's got like this little sort of coil inside there that moves the needle back out, all right? And then you just want to dab on the area with your cotton pad, all right? And that's the injection part, all right? All taken care of. So it's relatively painless. Where are you? Hello there. It's really painless. Nothing to be scared about. So I've done it for this 6 rounds now because I've had taking off my glove, 6 rounds of chemo, and I've done it for seven days, right? So they only give you 1 series every block of chemo. So depending on what your blood panel comes back at, you may or may not need it. If your blood is healthy, then you might not need it. But I have needed it, and it's really helped me maintain my blood white level counts. At one point, it was pretty serious. It was down to a very low level, and it's not very good to have a low white blood cell count because then you're prone to infection. It's not good to have a low platelet count because then when you have cuts or bruises, they don't heal very quickly. All right. And of course, the hemoglobin is about having oxygen in your blood. So if you have a low hemoglobin count, then you're huffing and puffing, and you're putting strain on your heart and your other vital organs, all right? Because the blood is not pulsating and it's not oxygenated. So having a healthy blood is very important during the chemo process. That's the whole point of this particular video. And if you need a transfusion, go get a transfusion, because those folks gave their blood to help you, and that's how you should view it. And it's a painstaking process. It takes 4 hours per unit for a blood transfusion. So you're going to spend your whole day in the ER or the transfusion center, wherever you're going, or the hospital if you're admitted. Um, if you're going to have 2 units, you're probably going to be admitted into the hospital. All right. So just keep that in mind to make preparations and plans. You know, if you have to take care of a dog or family or something like that, you have to consider all of these factors if you're going to be admitted into the hospital. All right, so that's and I always forget the name of this thing, which is terrible, right? uh, Nivestym, that's what it's called, Nivestym. All right, so that's how to take a Nivestym, or I can't remember the other names, but there are a whole bunch of other names for this particular injection. All right, so that's it. See you later. Sorry I had to show you my belly, but I had to do it to do the injection. Okay, thank you. Bye.